thank you for participating in the ACP Wellness Wave. My name is Eric. I'm a medical student at UC Davis School of Medicine. Today, I am honored to interview Dr. Garcia, and we are representing the California ACP chapter of Northern California. So Dr. Garcia, can you be so kind as to tell our ACP viewers a little about yourself and what you do?
Yes, thank you, Eric. So I'm Dr. Jorge Garcia. I'm a first-generation high school graduate, college graduate, and health professional. I'm a general internist, and I currently serve as a health sciences clinical professor of internal medicine and as the Associate Dean for Diverse and Inclusive Learning Communities at the UC Davis School of Medicine. So for the past 26 and a half years, my work has been focused on nurturing the next generation of healthcare professionals from diverse and underrepresented backgrounds. What a great privilege that's been for me. But an interesting thing about my story is that I almost didn't become an internist. And that's because I really struggled in medical school, particularly in my third year clerkships. Internal medicine actually was my worst rotation. I nearly failed it. And because I didn't get, I think, the coaching and the nurturing and encouragement I needed, it really made my selection of a career very, very challenging. But I'm glad I got it right. And I'm glad I have this privilege now of doing this work.
Wow, what an incredible comeback story. That's so inspiring. What advice can you share with our current medical students and residents about how to persevere through their careers?
Well, I think there's nothing like surrounding yourself with the right people who will encourage and nurture you. Sometimes students ask, well, Dr. Garcia, if that's your story, how in the world and why did you choose internal medicine? You know, it sort of goes according to what the sort of popular notion is that you go into the specialty that you excel in. But I tell people I was spectacularly unspectacular as a medical student, didn't really do much of anything. And even though my residents and attendings didn't nurture me, what I found was it was my patients who saw something in me. And when I think back to having to make that decision, like what am I gonna do as a fourth year student in terms of my sub-Is, it really was looking back over the third year and thinking, okay, when did I have those experiences when I most felt like the doctor I wanted to be? And what came to mind was just those quiet moments with patients who said things to me like, you know, Jorge, you're not the sharpest pencil in the drawer, but if you don't know something, you know where to go get the answers for me. And Jorge, I love your bedside manner. You can be my doctor someday. So I like to say that they recognized the future Professor Garcia, and they honored me. And when I ultimately chose academic medicine as a career, I think it's because I wanted to be part of the solution. I wanted to make sure that my learners would not have to go through the struggles that I did, that the learning environment could be improved, even if I had to just do it myself. And I'm glad I don't have to.
Yeah, so certainly medicine comes with so much stress on the day-to-day, as you mentioned, as a medical student, but now that you're an attending, could you share with our viewers how you deal with your day-to-day stressors now?
So I've learned the wisdom of just living in the moment and taking things one day, one step at a time. So the truth is that I have less than 24 hours a day to do everything that I need to do. So I've cultivated that practice of just mentally making a list of the things that I can reasonably accomplish every day, remembering that I need to make time to eat, to sleep, to spend quality time with loved ones, and to focus on my health. And so on most days, I say I'm batting 700 to 800. Some days much, much better. But I get through it that way. I get through it because, yeah, there's for all of us just way too much to do and not enough time. And so when I'm able to sort of do that, I find that I'm able to prioritize things and get through it.
Yeah, awesome. And with the time remaining, Could you just share with us, how do you handle perfectionism in medicine?
Oh, that's a great question. So I remind myself on a regular basis that perfection is not required, right? I'm never going to be perfect. Our great nation is still on this quest to form a more perfect union, right? So I remember that wisdom. As I like to quip, my wife and my children remind me on a regular basis that I'm far from perfect. But I'm thankful for them. They keep me grounded and humble. And I appreciate how much they love and appreciate me. And the same goes for my colleagues, my learners, my patients, that I love it when patients say, oh, Dr. Garcia, I don't always check my sugars, or I don't always eat the way I'm supposed to, or sometimes I forget my medicine. And I say, that's okay, right? Because I know you're doing your best. And I said, I hope you'll remember that when I might make a mistake or overlook things, that I'm not perfect, but I'm doing my best too. And I think when we can get real like that with our patients, they see that, they appreciate that. And it's what makes this life as a physician so rich, so wonderful.
Awesome. Well, once again, I want to thank you so much for your time and all your wisdom today. And I'm sure our viewers will really learn a lot from everything that you've shared with us.
Thank you, Eric. It's been a privilege.